Hello everyone, today we'll be presenting our group project on Muslim cultural diet and healthcare. Our group consists of Liz, Mel, Rosa, and myself, Eddie. We will begin by talking about religion. There are over 1 billion Muslims worldwide, and Islam, the religion practiced by Muslims, is the third most common religion in the United States. Unlike Christians who follow the Bible, Muslims follow the Islamic principle from the Holy Quran. They believe in one God, Allah, and follow the teachings of the Prophet Muhammad, the founder of the religion. Muslim life revolves around the 5 pillars of Islam, which influence daily activities including healthcare and diet. We will now move on to diet. Majority of Muslims eat a Mediterranean-style diet. This diet consists of vegetables, fruits, whole grains, beans, nuts, seeds, olive oil, and seasonings with herbs and spices. This diet is beneficial and has been linked to lower risk factors for heart disease, such as high blood pressure and high cholesterol. It is especially important to know that Muslims follow the Islamic dietary code. Foods that meet this code are called halal, meaning lawful in Arabic. Halal foods are those that are free from any ingredients that Muslims are prohibited from consuming. Foods that do not meet this code are called haram, meaning forbidden in Arabic. The Holy Quran specifies that Muslims are forbidden to eat any pork and all its byproducts, any bird with talons, blood and its byproducts, carnivorous animals, reptiles and insects, alcoholic beverages or intoxicants, and any animals that was not slaughtered according to the Islamic guidelines. Another crucial element of the Muslim diet is fasting during the month of Ramadan. To provide proper care plans and appropriate dietary needs, healthcare professionals should learn and understand the importance of Ramadan, as this could pose as a challenging time when providing care. Ramadan commemorates the first revelation from God to the Prophet Muhammad. During this time, Muslims abstain from food, drinks, and sex during daylight hours. Ramadan lasts approximately 29 to 30 days. It is considered an obligatory duty for all healthy Muslims. It exempts those who are sick or medically unfit to safely practice fasting. Healthcare beliefs. Western medicine focuses on body, comfort, and cure of disease, whereas the Eastern view is more focused on the body and mind. Their philosophy is to integrate holistic care, spiritual, emotional, and psychosocial aspects. As healthcare providers, we should be mindful of gender restrictions when taking care of Muslim patients. Males and females cannot be in the same room alone. If possible, same gender medical providers should be provided. We should also be mindful of modesty restrictions. Muslims forbid revealing body parts from navel to knees. When assessing these patients, the nurse should only expose body parts that are being examined. As a registered nurse, we can learn and understand the Muslim culture. We can do this by giving our patients plenty of time to allow for privacy and modesty. During Ramadan, try to work with Muslim patients' fasting schedule if it is safe to do so. Lastly, be mindful and respectful of everyone's beliefs, diet, and culture. It is our responsibility to make our patients feel comfortable physically, mentally, and spiritually. We will now move on to our first NCLEX question. A Muslim female patient has been assigned to a male nurse. As the nurse enters the room, the patient becomes very upset. The nurse understands that this patient is upset because of what component of this patient's religious beliefs. A. She does not think she is ill. B. Her husband is not present. C. She cannot speak English. Or D. She prefers to be taken care of by a female. Answer is D. NCLEX question number 2. The nurse is preparing to administer medication to a Muslim patient. Which medication would the culturally competent nurse consider asking the patient's preference before administering? A. Opiates. B. Blood products. C. NSAIDs. Or D. IV medications. Answer is A. We will now move on to our first nursing diagnosis: imbalanced nutrition, less than body requirements related to insufficient dietary intake, as evidence based by food intake less than recommended daily allowance. SMART goal: during Ramadan, patient will eat 75% or more of meals before sunrise and after sundown. Our first intervention will be provide halal meals. Second intervention will be discuss with MD the potential need for referral to dietitian. Our second nursing diagnosis is dehydration related to religious fasting, as evidence based by decreased skin turgor and decreased urine output. Our SMART goal will be patient will increase fluid intake and maintain urine output of 700 mL per day. Our first intervention will be encourage patient to drink 6 to 8 cups of water per day. Second intervention will be when fasting is broke, encourage the patient to eat foods high in fluid volume, example, watermelon. Our last nursing diagnosis is risk for unstable blood glucose related to insufficient dietary intake. Our SMART goal is to maintain fasting blood glucose level between 70 and 130. Our first intervention will be offer snacks high in carbohydrates, and the second intervention will be educate patient on signs and symptoms of hypoglycemia and hyperglycemia. Summarization: with growing numbers of Muslims in the United States, it becomes vital that healthcare staff become more culturally sensitive to the Muslim population. To become culturally literate, providers, clinicians, and nurses must learn and understand their culture, beliefs, and practices. Dietary regimen of cultures is vast and plays a key role in a healthcare setting. To conclude, here are our references.